Welcome, my name is Peter Strong. I provide online therapy via Skype for treating anxiety and depression, and particularly for providing help in overcoming agoraphobia. So if you're interested in online therapy for agoraphobia, then do please go to my website, learn more about this online service, and then contact me if you'd like to schedule a Skype therapy session for agoraphobia. I've developed a particularly effective method of working with agoraphobia and other anxiety disorders that's called mindfulness-based exposure therapy. This is a way of working in a very practical and very focused way with your anxiety. It allows you to progressively increase your confidence and decrease the intensity of those anxiety reactions. Exposure therapy is almost always recommended for treating agoraphobia and other kinds of phobias as well, but it has to be done in the right way. It has to be done in a strategic way. So in mindfulness-based therapy for agoraphobia, we do this by designing a series of challenges of increasing difficulty, but then we prepare very thoroughly for each exposure challenge. We do this by meditating on the exposure challenge that we're about to do. We play it through in the mind, and then we look for any anxiety reactions that might get triggered. We work with these anxiety reactions in our meditation session before doing the challenge to help that anxiety resolve itself, to heal. So all anxiety reactions are basically habitual in nature. They are conditioned reactive habits that got started for one reason or another. It doesn't really matter how they got started. The issue is that they have become established and they operate subconsciously as habits. So we need to bring them into consciousness in order to change that subconscious aspect of the habit. And this is the focus of mindfulness meditation. We bring that anxiety into mindful awareness, into conscious awareness. And then we begin to explore breaking free from that compulsive identification with the anxiety. You can become the observer of the anxiety and not become identified with it, and also not react to it with further reactivity. The thing to remember here is that it is the reactivity to the anxiety that's the main problem. That reactivity, which is often in the form of avoidance or self-hatred, being very critical of yourself for having that anxiety in the first place. It could be trying to escape the anxiety reactions through distraction or any other countless forms of reactivity. These reactive habits feed that anxiety and they prevent it from healing. If you stop feeding it, it will heal. That is absolutely for certain. But you have to learn how to counteract and neutralize these secondary reactions that feed that anxiety. So that's the first part of mindfulness training. We want to see the anxiety very clearly, but on conscious terms, on our own terms, That's why we meditate on that anxiety, so we can introduce it into our conscious awareness without that blind, unconscious aspect. We can see it clearly. And one of the general rules in mindfulness therapy, this particular system that I've developed over the years, is that the more you see, the freer you become. This is a very important theme. So we want to really see all of the aspects of that anxiety. And there are other things too that are very important to overcoming the basic reactivity to the anxiety, and that is overcoming the tendency to identify with the anxiety. This is called reactive identification. It's where we literally become the anxiety, and then we become a prisoner of that anxiety, and that really is the first step that leads to the proliferation of more reactivity that feeds that anxiety. So in any case, during this initial training with the anxiety, you're learning to free yourself from all of those habitual reactive patterns. When you've done that, and when you can imagine doing the exposure challenge without falling under the influence of those anxiety reactions, then is the time to do the exposure challenge. And basically, during the live challenge, you'll be putting your training into practice. And so reinforcing these new pathways whereby the anxiety resolves itself rather than creating more anxiety. We may meditate after the challenge as well. That's very important. So you can work with any fresh anxiety that arose during the live challenge. And we help that resolve. And then we repeat the exposure challenge. So if you take this kind of very strategic approach, you will see big changes in a very short time. So if you'd like to learn more about agoraphobia therapy online using mindfulness therapy, then do please contact me and let's schedule a Skype therapy session. Thank you.